Welcome back. Here with us on Mirror Now. Let's get you the latest update as far as India's COVID count is concerned. In India, we saw 1,247 new COVID cases coming in last 24 hours, a 43% decline from a day earlier. According to the Union Ministry of Health and Family Welfare, the country also reported one COVID-related death, bringing the total number of fatalities to 5.21 lakh. The daily positivity rate has increased to 0.83% from 0.31% earlier. The weekly positivity rate has seen a minor uptick and it stands at about 0.32%. Delhi has recorded nearly 26% jump in fresh COVID cases in the last 24 hours. Positivity rate has been reported at about 4.42%. Now, what is even more concerning is the case count that we are seeing emerging from schools in Delhi and NCR. The DDMA, as I mentioned earlier, will be holding an important meeting tomorrow. Union Health Secretary Rajesh Bhushan has written to Haryana, Uttar Pradesh, Delhi, Maharashtra and Mizoram on the increasing positivity rate and the case count. So how should we really look at the current situation? Let's try and ask our experts joining us on the broadcast. Dr. Isaac Bogoch, infectious diseases physician and scientist, live with us this evening. We're also joined by Dr. Naresh Trehan, Chairman and MD Medanta. Appreciate both of you for joining us here on Urban Debate on Mirror Now this evening. Dr. Naresh Trehan, we are suddenly seeing a lot of school children testing positive for COVID-19. How should we see this situation and what exactly is happening in your opinion?
So it's not totally surprising that this is happening because, the children have not been vaccinated fully. And also it's very difficult for children when they're in school to maintain any COVID appropriate behavior because, the masks come off, the children want to play with each other, close contact. So the spread, as you've seen in some schools, and which some of them had to be shut down, is actually in a way expected, but it is a sort of very disturbing fact because some children are getting sick also. Majority of them are not. Like we have in our own hospital at Medanta, we have a couple of kids who came in with tachycardia, not feeling well, Omicron. So the basic thing that we have to watch out for is that how rapidly is it spreading, because the numbers have gone up exponentially. The number went up to 7.7% positivity a couple of days ago. It's now 4.4 today. So overall, it's something that is ringing alarm bells. So we should be now again, like we say, alert about what's going to happen in the coming days. So what did happen in the last few days or last few weeks was that masks were discontinued. I think it's important to go back to masking because that's the only protection we really had. The second thing is the booster dose or the precautionary dose. So we saw in the early days of the government advising that yes, everybody above the age of 18 could get a precautionary dose. The numbers that were coming for the vaccination were actually not so minuscule, I would say. But in the last 3-4 days, as the numbers have started going up, now people are getting serious and getting the booster dose. So I think that the public should know that there is definitely a protection from the booster dose. So those who have actually completed 9 months, I think they should actually get vaccinated as fast as possible because they should not risk themselves and exposed to what is happening. Because if you see what's happening in Shanghai, it's a very disturbing picture. In spite of them locking up the whole city and very, very stringent measures, the numbers are still climbing. 5,000-6,000 a day. So I think that this is a clear alert warning, and the government is actually monitoring real time around the different districts, and there is real time information coming. So I think that the monitoring is in place. And we should respond quickly rather than be complacent. So this is time for concern.
Okay. This is time for concern, and two important points you have made, Dr. Trehan. One, we need to get the masks back because many states have already dropped the mask mandate. And apart from that, people who are eligible should quickly go and get their booster shots because it's now available for everyone above the age of 18. Dr. Isaac, I want to understand from you specifically the way children are testing positive, and not all children are eligible for vaccine shots here in India who have also started going to school. So how should we see this, and should the governments in the states where cases are coming from consider closing the schools for some time, or we need to live with it?
It's a very difficult and obviously very challenging, and it's a very difficult situation. For starters, I agree. It doesn't come to anyone's surprise when you start to see COVID amplify in school settings, right? It's one of the largest sanctioned mass gathering events that we have in our various countries. You have literally millions of kids in an indoor setting in close proximity for prolonged periods of time, in many situations without masks and in many situations without vaccines. And this is in the context of having a very, very transmissible respiratory viral infection. What did we think was going to happen? Of course, it's going to amplify in those settings. That's exactly the type of setting that this amplifies in. So while it's helpful that most kids don't get that sick from COVID, we don't want anyone to get this infection, and especially acknowledging that some kids do get very sick from this. And of course, kids can bring it home to family members. They might have an elderly parent or grandparent who can catch this, and this can help amplify, sadly, the infection in the community. There are simple steps that you can take to help reduce the risk of transmission in these settings. We've touched on them a bit earlier, but just to reiterate the importance of these. And again, some of them are contentious, and of course, there's always debate around masks, and some people feel very strongly for or against, but you just can't deny that masks can help reduce the risk. Doesn't eliminate the risk, it can reduce the risk of COVID. You can improve the ventilation in indoor settings, which will help reduce the risk. And that doesn't necessarily mean buying expensive equipment. Simple things like opening windows and doors may help improve ventilation. Vaccination for those who are eligible, of course, will go a long way. And like, these are tools that you can have. Now, closing schools down is obviously a very contentious issue, and I would certainly leave it to the public health experts in those regions to discuss if the merits of that outweigh the risks of that as well. I think that's a very local issue and certainly very contentious. We've seen that in many parts of the world.
Okay, Dr. Naresh Trehan, what is your opinion? Is closing schools a solution, at least in those specific states where we are seeing a rise in COVID cases?
I think so. I think that one of the things that we should be cautious about, because what happens is not only do the children get infected from each other, but they take it home. And you can have elderly people in your home who you infect, and then there is a problem. So, in all this, we were getting some comfort that overwhelmingly it was Omicron, which was proving to be a little mild, and people did get sick for 3-4 days, but most of them recovered very quickly. But now we are also seeing an odd case of Delta coming back. Now that's disturbing, because if it is lurking in the background and Delta comes back, you remember how devastating the second wave was. So I think that it is time that we do at least the minimum protection that we are talking about. Like we said, masking, distancing, and schools will have to take a decision, because depending on their local environment, can they provide that well-ventilated environment or not? Introduce hybrid teaching again, so that the ones who do not want to come and get exposed, and also the fact is that the classes may get lighter, fewer children coming to the same class. I think that will help. But also the fact is that there is vaccination available now, about 12, but the basic problem still exists that from 2 onwards, 2 years to 12 years, there is no vaccine available yet. So the point is to accelerate the approval process for those which are good candidates, potentially good candidates, to come to the market immediately. So I think that if we take all these measures, the other thing that I would say is that we have gone back to large parties, indoor parties. I think that's also a very bad setup. So basically move whatever you can outdoors, reduce the number of people in the same room, and also masking should be essential. So I think if we take these measures, we can ride this over the next 4 to 6 weeks, which is the danger period. 4 weeks, if we can do it, I think that we could stymie this new sort of wave, if you call it, or whatever, but we can prevent it from becoming a wave. So if everybody cooperates, everybody is careful, we are in a good position to get beyond this, whatever surge is happening right now. But the other thing that we have to worry about is that there are some more variants, like they say, the X variant where there is B1 and B2 actually combined may turn out to be a bad problem. So that's the other reason we should be very careful.
Okay. So hybrid teaching system, of course, can be brought back for some time. You're saying 4 to 6 weeks are crucial. So that's something that the governments can really consider, at least in the national capital and in Haryana, where we are actually seeing a spike in cases. One last question, Dr. Isaac, before we let you go. What variant of COVID, in your opinion, this is? Because people who are getting infected, and here I'm talking about children as well specifically, they are recovering in 3 to 4 days, and many are seeing this as like normal flu. The governments also have started saying that we need to learn to live with COVID. So are we now likely to continue to see this kind of situation, that COVID will continue to infect people, but the severity is not going to be very bad. It's going to be milder.
Yeah, I think there's a couple of high-level points there. Just because it might be milder on a case-by-case basis, for example, Omicron versus Delta, it's not mild in everyone, and it can still pack a punch. So while it's true it might be milder than Delta, we still see people can get significantly impacted by this. The second point is that it's more transmissible. And when we think about population level health and community level health, a more transmissible variant is a much greater challenge. So even if a small percentage of people with Omicron get sick enough to land in hospital, a small percentage of a massive number of people infected still ends up with a lot of people in hospital and has the capability to overwhelm healthcare systems. So I think it's appropriate to have a healthy respect for the variants of concern and for COVID, and approach this cautiously. The last point is, we hear this term learning to live with COVID. Sometimes this term is weaponized. Sometimes this term is used to underplay the significance of COVID. I mean, it depends on who's using the word. It might be defined however they see fit. But I like to think of learning to live with COVID. I really like to emphasize the live component. We want to live, not die. And the simple steps that we've discussed, masking, improved ventilation, vaccination, all of these can really help create safer indoor spaces, which we know are where COVID is primarily transmitted, and really taking steps to create healthy and safer indoor spaces for everybody will go a long way. One last point. Vaccinations are fantastic. We know antivirals are coming out, and these are also look like they're going to be very, very helpful, but they only work if they're accessible to everybody. And I think we still need to make, depending on where you are in the world, some significant inroads into under-vaccinated communities, under-vaccinated populations that really provide equitable access to vaccines and treatments, because this really helps and really only works if you help everybody, not just select populations that have greater access to this.
All right, Dr. Isaac, Dr. Naresh Trehan, appreciate both of you for joining us here on Urban Debate on Mirror Now this evening. Tomorrow is an important meeting in the national capital. We'll see eventually what decisions are taken after that particular meeting about the people in Delhi. Let's now move on, and there's some breaking